Welcome back to Taiwan Outlook. Joining us today is Professor Xin Zhou. Professor Zhou, we've been talking about Taiwan's national health insurance system. And in addition to the better management of the medical service and also the better evaluation of the insurance system, what are the alternatives that we can introduce to reduce the costs of the, the global budgeting system?
Well, I mean, the main purpose of national health insurance is to improve the health among the population.
Yeah.
But government has a lot of other choices. In addition to the national health insurance, government can build many public hospitals.
Mm-hmm.
Government can simply give money, give cash to the poor people so that they can have resources to seek the treatment that they need. Alternatively, I want to emphasize that education policy, is also important. According to many studies, parental education may have significant impact on child well-being, including their education outcome and health outcome. So when government evaluate education policy, they should not ignore the external benefits resulted from the higher education received by their people.
What do you mean by parental education?
So, like, if parents, according to our studies, like if parents are highly educated, if they receive more education, they have more knowledge to raise their kids. They will be more careful and they will educate their kids more, right? They may be more efficient to take care of their kids. So according to some of my research, if parents' education are higher, they will, the mortality, the infant mortality, neonatal mortality will be lower, and the low birth weight, the probability of having a preterm baby, the probability of having a low birth weight babies will be lower. Moreover, we also, according to our research, we also find that if parents' education are higher and if your kids are low birth weight, it's more likely that parents with higher education are more likely to buffer the negative impact resulting from being a low birth weight baby. Because according to a lot of research, low birth weight baby tend to have lower educational academic achievement. But if your parents are highly educated, it's more likely to buffer this negative result. In other words, if parents' education are higher, their kids, no matter whether it's normal birth weight or low birth weight, will perform similarly.
So, Professor Zhou, if the parental education is very influential in terms of raising the kids' awareness of the health, what can we do about that to improve the school education or improve the parents' educational level?
Well, actually, everyone will become parents one day. So, my point is that we have to, try to emphasize. We have to emphasize education. Now, everyone needs to receive quality education, and everyone has to go to school. But right now everyone goes to school in Taiwan. So we also need to emphasize the quality of education, of course.
Yeah.
Right.
Another issue that might impact our national insurance system is the society is getting older and older. So do you think that our health insurance system has pretty much ready for this aging society problem in Taiwan?
I don't think we are ready for that. On one hand, our aging, our aging population is probably we will probably rank the second, of the aging population in Asian countries. We have many aging population, in the next couple years, and combining with our low fertility in recent years, like in the past, our fertility, our birth rate, every year we probably have 300,000 babies every year. But in recent years, like in the past 5 years, every year we only have like 200,000 babies. So I do think that, how to take care of elderly, how to take care of old people will be a very important issue, in the next 10 years or so. Especially right now, the national health insurance. Our national health insurance does not cover nursing home care, does not cover home health care. So a lot of people need to pay by themselves to find medical aids to assist them to in terms of daily livings. So I do think that's something the government has to consider in the future.
But now we have combined problems. On the one hand, you have more and more elderly, but on the other hand, you have fewer young people.
Right. So this makes the problem more important, because in the future, those elderly people, they will be very dependent, and they don't have kids to take care of them.
Yeah.
Right. In Chinese culture, it's always the case that the kids will take care of their parents, but because of the low fertility, the government probably needs to, contemplate this problem. Right.
But I think that kind of problem is not unique to Taiwan. I think other countries also have the similar problems.
Right.
How do other countries combat,
So
these problems?
like in the United States, they have universal health insurance for the elderly. So if you are older than 65, you have Medicare. Medicare will cover all your hospital care, all your healthcare services. Starting in 2005, Medicare started cover their prescription drug. So in other words, in the United States, elderly are now well taken care of. They have Medicare to cover their hospital care.
And nursing services all covered by the insurance system?
By the government, right? So the government provide Medicare to the elderly who are older than 65. In addition to Medicare, if you are very poor, you will be eligible to Medicaid, and Medicaid will cover their nursing home care. So in other words, Medicaid will take care of their long-term care.
Yeah.
Right.
But in Taiwan, as you say, that currently we don't cover.
We don't cover that part. We don't cover nursing home care. We don't cover home health care. So if you have money, you can hire some, foreign laborers to take care of your parents.
Yeah.
Right.
But the thing is, as you say, that if you want to cover that part, the cost for the whole insurance system will be very expensive.
Right. It will become very expensive, and it will become a heavy burden for the young generation.
That's right.
Because all the money will come from their tax. That's the case in the United States. Right now, we work now, we get our paycheck, but some of the money has to go to the Medicare trust fund. Some of the money has to go to the government. Right.
But did that touch upon what kind of state we are having right now? Is that a welfare state or just a very market-oriented state? Do you think that we should introduce a very comprehensive social welfare system to Taiwan?
I do think that we have to do it step by step. Like hospital care. I do think that covering nursing home care, especially for the poor and disabled, is very important. For hospital care, I think we should increase the copay. Somehow the government has to balance the budget. It is impossible to cover everything and to please everyone. It's impossible. Then the government should think, who needs those care most, right? The poor, the disabled. So, that will be the first priority.
You've been saying that maybe we should raise the money you have to pay for by yourself, copay.
Right.
But the thing is, maybe for the poor and the disadvantaged people,
right,
it has been very difficult already for them to
right. Then
pay
maybe
the copay.
We can waive their copay or something. Right. But for general public, I do think that
people have been questioning about the current system because it seems to be fair. But the thing is, for the rich people and for the poor people, they seems to be paid the same thing. Do you think that's the case?
Like the premiums, because the premium is very low, but the premiums for the poor people are all covered by the government.
Yeah.
But it's not that much. And if we really want to keep this system going, I do think that we probably need to raise the copay for the general public, but probably lower the copay, just charge a lower copay for the poor people. Yeah, but we actually, some studies in the United States, because United States is probably the only country, the only very developed country that does not have national health insurance. So in the past, several years, the U.S. government, they try, some people suggest that they should adopt national health insurance, and some people say that they cannot, they shouldn't. So there has been a lot of studies discussing, how to manage, how to implement this national health insurance. And, if we want to implement the copay based on the income, it is hard. It is hard. Because, you need to get the information on the income. But, because Taiwan is not that big, so I think it's possible to probably implement this, income-based administration.
As we know, there are some
Taiwan.
Taiwanese people abroad now, in China or in other countries. When they are sick, they come back to Taiwan and to get the treatment and to get their insurance, covering all the things they are having.
Right.
So do you think that kind of system can sustain itself for good? To cover everybody, even for those people who travel and live in other countries doing business there?
Yeah, so as you mentioned, our healthcare system is just too generous, So if the government, if we really want to control the cost, I do think that we need to think more carefully, who should be covered and who should not be covered.
Any suggestions about whom should not be covered? By
so like us, a lot of people actually suggest me to
buy insurance here.
Yeah, to buy national health insurance. Just pay the premium every month, and if I need the care, I can come back to come back to Taiwan anytime. The air ticket is cheaper than the healthcare in the United States, right? So but I did not do that.
But as far as I know, there are many Taiwanese business people.
Right.
Now they are living in the mainland, and they of course they pay the premiums every month.
Right.
But the thing is, when they get sick, they just all the way fly back to Taiwan for go to see a dentist. For instance, very expensive, and not safe to see the dentist treatment in the mainland. So do you think that's a possibility to reduce some of the limitations of the coverage?
It's hard to say who should be covered and who should not be covered because everyone has different occupation. But the general rule is that we need to cover the poor people. Yeah. We need to cover the poor people, and the copay should be higher. For the dental services, those the services that are more likely to have moral hazard. For example, people are more likely to waste the resources, using more general terms. For those services that people are more likely to waste the resources, we should increase the copay. So this is why the U.S. private health insurance, they do not cover dental health because people are more likely to waste the resources if the dental care is covered. For example, people are more likely to clean their, teeth, things like that. They are more likely to do some, cosmetic surgery or things like that, right? So.
But you talk about the waste of the resources, but some people criticize the system for some structural incentives for people to waste some of the resources. What are those problems we are having right now?
I think the problem, again, back to my point, the problem of our system is that our copay is too low. So, everyone, no matter whether you are having a headache or, just have some running nose, you will always go to see a doctor and get some drugs. And all the prescriptions are covered, right? So, every time when you are sick, when you have some small problems, you will go to see the doctors. So,
but the government now currently introduced a new system asking people to go to see different hospitals, community hospitals, private hospitals, and then go to the so-called university hospitals.
Right.
Do you think that's a good strategy to reduce some of the incentives for people to waste the resources?
You know, that's another problem because in Taiwan, people have freedom to choose any hospital, any clinic that they can, you know, they want to go.
Yeah.
So, you know, if everything is covered, everyone has strong incentive to go to the best, to go to the most famous hospitals in Taiwan, right? So that's very different from the system in the United States.
And in the UK as well, you know.
Right, yeah. In the United States, we have to go to see the primary care physician first. So everyone has a long relationship with their family doctor. You have to always see your family doctor before you see any specialist in the United States, right? But in Taiwan, you know, people have freedom to choose anything. But I do think it's probably very difficult to implement this, you know, primary care physician system in Taiwan, right? Because you know, we are not used to that kind of system.
Okay.
Yeah.
I think children are our future, and their health is very important for this country and for the sustainability of the health insurance system. So when we come back, we will talk about one of the key health problems that our kids are facing, obesity. So stay with us. We'll be back in a few moments.